So my name is Sarah Gopman. I'm a family physician, and I also practice maternal and child health, which is the care of women and families, young families, including primary care and pediatric care. And then I have sort of a subspecialty of addictions medicine. So I take care of individuals who have substance use disorders. I think one of the reasons why understanding the biology of the dependence on opioids is so important is that because once we understand that and once we are able to treat the biology of it, then we can allow people to become stable enough to start healing the psychological parts of it. And so when we think about how people become dependent on opioids, we have to think about receptors in our brain called opioid receptors. And we could think of them as sort of like outlets into which a plug goes, like an electrical outlet. And the plug is, in this case, it can be a natural substance like an endorphin, which is sort of a natural chemical that we produce and that drives the experience of pleasure. So, for example, if we saw a beautiful sunset, we might experience some endorphins, or if we ate some delicious food. But as it turns out, when the drug plugs into that receptor, it activates it in a much more intense way and much more quickly compared to those natural experiences of tasting something delicious or seeing something beautiful. And so people then become dependent on the receptor activation that happens from the drug, and it then self-reinforces. This is a biologic process, and I think understanding the degree to which this is not something that individual patients have control over. If we took any individual and gave them opioids for long enough and then took the opioids away, everybody universally would have those symptoms. The way I kind of describe it is, let's say that you had a terrible influenza and you were at home with a fever and chills and sweating and nauseated, and there was a medication sitting right beside you that you could take that would get rid of your symptoms. And yet you were told not to take that medication and just to sweat it out and have all those unpleasant symptoms for the next 5 to 7 days while you got through your influenza. Most people eventually would have a hard time not taking that pill that would make them feel better, or not taking that medication. And so when people are in withdrawal, that's really how they feel. They're, having terrible abdominal cramps. Their nose is running constantly. They have body aches. They can't lie still because they're so uncomfortable. And the degree of discomfort, I think, is just really hard to describe in words. It's one of those things that when you see it for the first time as a healthcare provider, or as a family member, or whatever your circumstance would be, when you're helping a person who has withdrawal, it's striking. It's a true medical illness. The idea that we can overcome a medical illness with willpower just doesn't make sense in any other context, but we try to apply it to substance use disorder because we have a lot of complex feelings about it in our society, and a lot of judgment goes into those notions of willpower as being the solution.